Hello, doctors, students, and friends of homeopathy. Today is the 1018th day of the uninterrupted session of Ifph. And today we are having an eminent personality, an international faculty from India, Professor Dr.T.AJAYAN, head of the Department of Practice of Medicine, Sharada Krishna Homeopathic Medical College, Kulashekharam, Tamil Nadu. He is the national level faculty of IHK. He is the winner of Dr. N.K. Jairam Award, and he do have more than 24 years of experience in the field. And the subject is concept of Constitution in clinical practice.
Thank you, sir. Sir, are you audible? As now it's audible.
Yeah.
Is it right, sir?
Yeah.
That's okay.
Let's start the session.
Okay, sir. Just I share my PowerPoint. After that, I just verify the audio. Then only you are continue. Okay, sir?
Yeah, sure.
Sir, is now visible, sir? Pinduraj, sir, is visible?
Yes. We can start.
Sir, one more I need that just verification of the sound. The sound is available. Just again you say. Sir, please wait.
Yeah, well, it's audible.
No, sir, not my sound. That is sound from a video clipping is and come out again. You say, please wait. Just for verification, sir. Is an audible, sir?
Are you saying about the sound of the slides? Yeah, it's audible.
Sound of the
audible.
slide.
Yeah, it's audible.
It's audible. Okay.
Yeah.
Come on.
Okay. Good evening to all. Respected the dignitaries and other my colleagues. And today's your moderator, Dr. Bindujaj. He's one of my senior. The respected other faculty members of IFPH and respected doctors. That today I would like to convey with you a topic. It's a constitution, the concept of constitution in clinical practice. You know, in clinical practice, the different method of prescription is there. Out of these, we are made then a totality. Then after that, they are prescribed the constitutional prescription, then mathematic, then the sector totality. The different levels of prescriptions we are made in our day-to-day practice. But today I would like to highlight what is the importance of constitution in clinical practice. It's a very broad topic, but the discussion of the constitution within the time limit is very difficult. But today I am trying to convey with you what is a few areas, one part of the constitution only I am discussed with you. But the different opinion regarding this topic. But I am trying to just to consult all this knowledge and share with you. You know the concept, why I then specify this particular topic, the concept. That means it's a principle or an idea. That just I would like to create an idea about that what is the constitution. Majority of my sections, majority of the doctors say very speedy, we are conveying this topic to others. Then others says we are not able to follow it. But this one is okay, Indra sir, this one is okay.
Yeah, but your audio is not clear. I think a little bit of clarity, lack of clarity is in your voice. I think it will be cleared. After sharing the slide itself, it started. Let me, you please continue on. Let's see.
Then now the voice is correct, sir. Now the voice.
Yeah, now it is okay.
Okay. Then here I would like to convey what is a concept. Concept means that just to an idea we are creating. Okay, sir. Now it's okay.
Yeah.
Then homeopathic concept, that is an everybody know, is a lead likes cures likes. That is an our law, that is similia similibus currenda. Then here that today's our topic is the constitution. That is a concept of constitution is widely applied in the practice of traditional Chinese medicine. Its concept quite similar to the homeopathic concepts. But here trying to highlight what is a constitution. Just a minute, please wait. The constitution is an English word, is coming from the Latin word, is a constituere. Is defined as the structure, composition, physical makeup, or a nature of the person. Then suppose then BK Bose, our gate practitioner in our Calcutta, even the patient is reached the door, he is immediately prescribed the medicine. That means that thorough knowledge about the materia medica is there. Materia medica means a medicine related knowledge is there. We are able to prescribe the right way. We are able to prescribe the homeopathy medicine. That medicine act as a remedy. Then here the constitution, we are work out the structure, composition, physical makeup, or nature of a person, comprising his or her inherent qualities, and this one is the modified by the environment. That is very what? At birth onwards, a person is birth onwards, then already the stigma is in transfer. Then through it, the single sperm and ovum is fused to form a zygote. That time itself, that programming is over. Then again, it's modified with an environment. That time, then environmental factors are influencing. That time only we are suffering from a particular disease. We will discuss later. The body constitution concepts the state that every individual has his or her unique body which react in a specific way to environmental influence. Then Henneman in his particular aphorism beautifully describe about the constitution. Everybody know the aphorism number 5. That is, he described like this, not only this chronic disease, but in acute disease, sometimes we are consider all these things. The two medicine for the differentiating, sometimes we are consider this constitution. But in chronic disease, we must consider this constitution. It will helpful for the thorough understanding of our miasmatic background of that particular individual. Therefore, Master says is useful to the physician in assisting him to cure or the particulars of the most probable exciting cause for acute disease. But in chronic disease, background. For understanding the chronic miasmatic background, we must consider is the constitution of the patient. That is ascertainable physical constitution of the patient. That is an intellectual character, his occupation, the mode of living, habit, his social and domestic relationship, everything you should consider. Okay. The next we are discussing what are the elements of the clinical practice. In our day-to-day practice, the international ethical and scientific quality standard for designing, conducting, recording, and reporting trials that involve the participation of human subject. That is a right clinical practice. Therefore, we are never simply approach a particular case, even an acute case or a chronic case. In clinical practice, very, very important one. Therefore, I say the international ethical and scientific quality standard you should follow. What they are is a designing, conducting, recording, and reporting trials that involve the participation of human subject. Therefore, each and every aspect of the case we are consider and prescribe the medicine. Then, therefore, we are discuss what is a model case report. The model case report includes, first one is the presenting complaints. In presenting complaints, Then before that, the preliminary data we are collecting from the patient, the location, sensation, pathology, modality, and concomitant. That means an associated symptom. I not describe the detail about the location and everything. For the right understanding, for the need of the clinical practice, first one is the beautiful case taking, the right case taking. For that, the right way we are collecting the presenting symptom. Then the vital part of the case taking is that any other area of the case taking, the vital part is the collection of history of presenting complaints. Suppose you know, then our aim, a homeopathy doctor, their aim, the first one is the diagnosis of the disease. Second one is the diagnosis of the individual. For the diagnosis of the disease, the first and very important area in our case taking is collecting the history of presenting complaints. If we are failed in collecting the history of presenting complaints, we are not able to diagnose a case and we are not able to diagnose of an individual. Individual means we are not able to select the right homeopathic medicine. Then different histories are included, history of past illness, family history, then personal history. The personal histories we are include the place of birth, then nutritional status, then marital status, sibling, etc. Then life space investigation. That is the beauty of the homeopathy case taking than any other science, other medical science. The beauty of the case taking in our science, that is, we are collection of the life space investigation. Why that is the importance of life space investigation? For right understanding of that constitution. In a particular constitution, the three important components are, one is the temperament, and second one is the personality, and third one is the diathesis under physical part, and one more is there in the physical part, the disease and aversion. Disease and aversion. Then all these things are helpful to understanding the right constitution. For the right way, we are trace out the life space investigation. We are able to work out the the constitution of the patient, and a particular constitution may be changed to then another constitution. That means the first slide we are discussing, these environmental factors are influencing. Then one more point, while the treatment side, the constitutions are divided into two categories, the changeable constitution. The study we have included what are the changeable constitution and what are the non-changeable constitution. Therefore, the vital role in our case taking for the study of our constitution, life space investigation is very, very important part. Then like this, the patient hails for an example, then hails from the socio-economic family. His father passed away when he has 2 years old. His mother was a coolie worker. He was a single child. He started to smoke at 5th standard and alcohol at 7th standard. He was not having any friend at school. At the age of 14, dropped out of his school. After that, of the started working. This way, we are trace out one by one, that chronologically. Then suppose the patient is sometimes it is not chronologically narrate her or his complaints, but a good physician, the chronologically arrange these life space. Okay, this one is not only for the collection of life space of the particular patient, even in collection of history of presenting complaints also, it should be we are followed. Okay. The next very important core part of case taking is the collection of general symptom. The general symptom, everybody know appetite test, stool, the eliminations, then you are not discovered, then aversion, the desire, the sweat. But desire and aversion and thermal modality, these are the another core part of the constitution. The constitution, there are two legs. Then for study of the constitution, the two legs are there. One is the mental part and second one is the physical part. Mental part include the two things. One is the temperament and second one is the personality. But the physical part, another very important two area. One is the tendency, that is the diathesis, and the second very important one is the generals. Therefore, the collect in generals, then disease and aversion, the thermal modality, these are very, very important part. Then we are collection of mental generals. Then next, then include the general examination. That is, the general examination also another very important area. Then here I would like to highlight it. That is a red ink. Then suppose the general build for understanding the physical general, the physical constitution. This general build is very important on lean, light. For example, lean or obese, thin, dark complexion, etc. Like this. Then like this particular case, the provisional diagnosis, our first name is then cervical spondylosis. For just to for understanding only, I convey this one a case in presenting in front of you. Then the next I would like to, then previously I say the aim of the homeopathy physicians are only two. Then any physicians, homeopathy physician aims are two. One is the diagnosis of the disease, and second one is the diagnosis. Almost all the seminars I would like to highlight in this point. That is, never use our diagnosis for therapeutic purpose. Sometimes it will help for the therapeutic purpose, no doubt. But the right way we are approach the cases, never use the diagnosis for the medicine selection. Okay, but our aim is the first one is the diagnosis, and second one is the diagnosis of the individual. While as a part of the case taking, then after collection of the case, then before the prescription of a medicine, next the vital part is an analysis of the case. An analysis of case, evaluation of the case. Then second one is after analysis only, next evaluation of the case. Then in all the chronic diseases, must your as an idea, that is this knowledge you should apply in clinical practice. That is, first you should put this case under Hahnemannian classification of disease. Then Hahnemannian classification of disease, the broadly divided into the first one is indisposition. That type of cases, no need of any treatment. Then second one is surgical disease. That type of surgical disease we cannot able to manage with the homeopathy medicine. And third one is the dynamic disease. This dynamic disease is divided into two. Acute and chronic, then chronic disease with the fully developed symptom is not our today's topic. That is an examples of Hahnemannian classification. Whether our patient under SORA or a psychotic or a syphilitic, the likewise we are put our case under a Hahnemannian classification is an very, very important one. And third one is the miasmatic diagnosis. And the fourth one is the constitutional analysis. That means why this we are put in the fourth position? Because for the right understanding the constitutional analysis, the miasm and Hahnemannian classification are very, very important. And the constitution analysis, if we are work out temperament, then diathesis, just a minute. Diathesis, then again, side affinity of the case, then thermal modality, everything we are considered. That is a standard case taking and case analysis. Case taking and a case analysis, then followed by case evaluation. After evaluation, you prepare the right totality, then followed by, then we are prepared the right PDF. And after that, then the medical knowledge we are applied and prescribe the right homeopathic medicine. Then that is constitution and its components. The constitution component, I previously say there are two legs. One is the mental part and second one is the physical part. Mental part include, that is a vital and very, very important area is to work out the temperament. Suppose for the right understanding, therefore in so many textbooks we are says, then we are not able to differentiate what is the constitution, what is the different from the temperament. The different textbook, then constitution other way says is a temperament. That means the right way we are work out the temperament, that is an 80% of constitutional workout is over. Therefore, the vital role is to work out the right temperament. The mental side, the temperament, then second one is the personality. And physical side, in second leg, that is a generals, that is disease, aversion, thermal modality. Then another vital role, vital, very important, the physical part is just you are work out the diathesis. This is a core. Just you are remember, always remember, because there's so many confusion in our case taking. What is the confusion? What is the difference between temperament and what is the difference in personality? And then likewise, there's so many concept-wise, the different opinion is there. Therefore, I will this particular constitutional class, I say to describe about the concept of the constitution. The constitution, two legs. What is the mental part and physical part? Mental part is an included temperament and personality, and the second part in the second leg is an include general, that include craving, aversion, thermals, diathesis, that is a rheumatic, gouty, bilious, etc. Then temperaments, what is the core part of the constitution is the temperament. Therefore, I would like that today, the first start the temperament, then remaining classes we are discussing the personality, and the second part of the second leg of the constitution is the physical part. That today, then I would like to highlight only this temperament. The temperament is the core of the constitution. Organization peculiar to the individual, including one's character or personality predisposition, which influence the manner through the action and general view of the life. That's the right definition I have collected from Stedman's Medical Dictionary. It's not this temperament definition is not related to our homeopathy perspective, but we are collecting that definition. And I am trying to work out that this particular definition is useful for the study of the homeopathic temperament. Therefore, I would like to the right definition. To convey the right definition is the psychological and biological organization peculiar to the individual, including one's character or personality predisposition, which influence the manner through and action and general view of the life. Then here, the temperament is the real me, the representation of a person, the real me, that is the temperament. Our temperament from according to our genetic material. That means then very beginning I say, even here a single zygote is formed, that time only, then already the programming is over. Almost all the physiological function, then our length, that means then different anatomical structures and its development, including in addition to this, developing, then the transferring the stigma. What happened tomorrow? Then again, this particular zygote, after developing a human, and mingle with an environment, that time here that person is suffering from different disease. Then here that we can build a statue of Dr. Hahnemann from clay, porcelain, plaster of Paris, of copper or silver, that they may look and identical in shape, size, proportion, etc., but they are not the same. You are remember. Then suppose we are prepared an Hahnemann statue, either we are prepared with the help of porcelain, clay, or plaster of Paris, copper or silver, but they may all look identical. While looking, that is a particular statue almost the same and its shape, size, proportion, etc., but is not the same, but is different. That is the quality of the raw material. The basic ingredient is the real person. Here, the temperament is the real me. That means that material you should work out. It's a real person. That is the temperament. The ingredient is the temperament. The statue is a temperament. That is the real one of the leg of the Constitution is the mental side. Mental side, the personality. Here we are through an example, we are differentiating what is a temperament, what is a personality. Then in our definition is a combination of mental, physical, and emotional trait of a person. It's a natural predisposition. That is our definition. Then just I have described through an iceberg phenomena. That is a presentation. Always then a iceberg is there. The 3/2 is almost immersed. Then here the changeable and non-changeable almost they are immersed. Inherited this personality and temperament. This temperament is a core. That is the personality is an outer. The mood is the presentation. Is a real disease. Is a presentation. Then here the mind. That is an emotion, thought, and behavior, the physical, the non-changeable physical appearance in temperament. Then here that I am trying to highlighting the different types of temperament. In our day-to-day practice, if a patient is arrived or reach in our side, at least we are work out these 5 temperament. Just an easiest way we are able to work out that just you consider this temperament for the medicine selection, that medicine definitely act as a curative level is active. Then temperaments are sanguine, is an phlegmatic, nervous is another temperament, another group of people have nervous temperament, melancholic, and choleric. These are the common temperaments we are seen in our day-to-day practice. Then today I would like to highlighting only one temperament is a sanguine temperament. Then if the time is available, just I will again the second one I am trying to highlighting the second choleric. But the time is available, just I am highlighting the 2 temperament. But remaining coming classes we are discussing the remaining temperament. Okay. Then just I am trying to convey with you what are the sanguine temperament persons we are convey with you. Then always the picture like then sanguine temperament. Here the sanguine is from a Latin sanguis, that means it represents blood, and originally means bloody. That's very simple one, sanguine. Sanguine then always in optimistic. That is everything is going to work out fine. That's one of the character of in our society. The different peoples are there from the different peoples we are able to identify the sanguine temperament persons is an optimistic that everything is going to work out fine. Then medieval the medicine is described the someone whose the ruddy complexion was a sign of an optimistic outlook. Then they are very social person always. These sanguine temperament persons are always social person who likes to be with the people. Always they are live with the people. That is in our politicians and always and social persons we are live with our peoples. Then they bring life and energy into a room by their very presence. There is another quality of the sanguine temperament. Just I'm trying to divide the sanguine temperament and mind and the physical part. The next slides we are helpful for you. There is an always the sanguine temperament peoples are extroverted peoples. Then an energetic persons who enjoy being with other person, other peoples. That is an extroverted. Then this is a core of the sanguine mind temperament. Sanguine mind temperament. 3 factors only you are considered. One is an extroverted people's optimistic. Then everybody know that is an optimistic. There is an hoping or believing like that. There is an optimistic peoples are always like this, hoping. There is an belief that the good things will happen in the future. then always we are trying for that one. That is an optimistic peoples. Then always a talker. That is an then talk a lot. That is a talker. It's a mind of the mindset of the sanguine temperament. Then the other then these are the then why I highlighting this capital letter. These are the core mind symptom of the people of the sanguine temperament. The remaining, they are very spontaneous, vivacious. This vivacious in Malayalam here says chunayulla, unmeshamulla. That means that is an vivacious, then cheerful always, then popular. They're trying to the popularity. They are always need the popularity. Then appealing. Then Malayalam is normally says an akarshakamaya. Then attracting, appealing. The good sense for humor. Then bubbly, the sympathy, sensitivity. These are the other aspect of the mind part of a sanguine temperament. Then in physical side, we are just your workout that people's always ruddy, fair for bright complexion, then fair hair, then strong muscle, small head, large chest. You are always remember. These are the characteristic physical appearance of a sanguine temperament. Fair hair, always. Then strong muscles, the small head and large chest, then bright complexion. The disease developed rapidly and frequently, regularly. These people's always, and the disease part is developed rapidly and frequently, regularly. Then liability to active hemorrhage. These are the physical property of physical character of, not property, is the character of a sanguine temperament. The here at least we are in our brain, you are carry, then brain just you keep it. These three important core part of the mind of a sanguine temperament is an always a talker, a optimistic and extroverted people. That just in the pictures we are helpful for you. Then always remember in your mind, extroverted. Then always an energetic person who enjoy being with other people. There is an optimistic. There's always then future. Then will happen something. Always good will happen within a soon. That way they are thinking. That is optimistic peoples. Then every time the person who talk a lot, too much, or in a particular way only they are presenting. That is a talker. These are the core part we are discuss with you. Then other main features, then spontaneous, that is done in a natural way without any planning or without being forced. Without any planning, he is spontaneously they are presenting. Then suppose a person you are reached in a podium, then immediately we are give a topic, immediately we are talk very nicely they are presenting that particular topic. That's just spontaneous. Without any hesitation, they are presenting there. Then vivacious, the attractively energetic and enthusiastic. Then suppose in a per day, 10 to 25 people are reaching our clinical site. Just this way you are evaluating cases. It's vivacious, then always cheerful, happy and positive. Then you said popular people, linked, enjoyed or supported by many people. There is an always then popular. The mind sanguine temperament, then there is always talking incessantly, the humorously engrossing the audience. Always they are cheerful, then humorously they are engrossing. Then suppose a teacher, then suppose we say the joke, then complain to the students, and then only you attend the classes. Then optimistic outlook and a quick but not lasting temper. Then the having fun on a job, making feel life a breeze. That is an extremely energetic, enthusiastic. The emotion side of the sanguine temperament, the appealing, the good sense for humor, then life of a party, then storyteller. Then there's a fruit of a sanguine, then affectability and cheerful sympathy, And generally, we are all this topic we are already discussed is sensitive, the compassion for the suffering of others. There is another one, very sensitive people, and the compassion for the suffering of others. Always they are bothered about the other people. The sincerity, very sincerity people. There is an sanguine people. Sincerity and the spontaneity. These are the features of a sanguine temperament. The physical part is a ruddy, fair or bright complexion, good digestion. They're almost there says in there, we are collecting the elimination always says and good digestion. There is no any issues. The fair hair, the strong muscles, small head, large chest. Then their social behavior side, suppose we are a friend, as a parent, as a work at work side, they are like this. Then as a friend, suppose our friends are always friendly. They're friendly, they are talking. The people's persons then thrive on compliments that does not hold grudge, like spontaneous activity. Just everybody seems to know him. Then as a parent, the max loving at home fun. Then people's the parent, the father, just you collect your interact with the people, interact with her daughter or a son. At that time, the majority of the students are says, my parent is like this. The max the living at home with the funds. Then admired by friends of children's. That turns disaster into a humor. The likewise they are acting, they are presenting at home as a parent. Then another social behavioral concern work is an always creatively their the creative works. Then always her or his work are colorful, enthusiastic, the charm other to work. These are the features we are seen in the sanguine temperament. Then just for the verification, just you see the film clip is an English section, I know, but the clippings we are collected from the Malayalam films. But those who are then understanding of what is there presenting there, the actors are presenting there. Just your left side, I will highlighting what are the character the portrayed in this particular video. Okay, then just please listen.
Oh, Ade,
അതെ ആ ഷോപ്പിംഗ് കോംപ്ലക്സിലും ജംഗ്ഷനിലും ഭയങ്കര റൂമർ.
എന്ത് റൂമർ?
ഞാൻ നിന്റെ അപ്പൂപ്പനാണ്.
അത് റൂമറാണോ?
നീ മാത്രം അങ്ങനെ ഗ്ലാമറായിട്ട് നടന്നാ മതിയോ? ഞാനും ഒന്ന് സ്മാർട്ട് ആവട്ടാ.
എന്നാ പിന്നെ അറിയാവുന്നവരെ കൊണ്ട് ഇതൊക്കെ ചെയ്യിപ്പിക്കേ. ഇല്ലെങ്കിൽ നാട്ടുകാരെന്താ പറയാന്നറിയോ? അച്ഛന്റെ തലയിലേക്ക് എന്താണ് ഒരിളക്കം? കുറച്ചു ദിവസമായിട്ട് ശ്രദ്ധിക്കുന്നുണ്ട്.
എന്തളക്കം?
വേണ്ട മോനെ, കൊക്ക് കറുത്താൽ കാക്കിയാവില്ല.
Then he is a cheerful and a good humored. Then he is a friendly in speech and always. Then find a childish joy and satisfaction in his outward appearance. He loves to behold himself in the mirror. Then he feels happy when praised. They want to just enjoy life. It's like these people are present in our clinical side. Just you remember, is a temperament, a particular temperament is a sanguine temperament. Just you look this video.
Thank you, uncle.
Famous film actor Jairam and his son.
ആ പോയത് ആരാണെന്ന് അറിയാമോ നിനക്ക്?
അറിയാം, മാറ്റിനങ്ങൾ.
ഈ മാറ്റിനങ്ങൾ ആരാണെന്ന് അറിയാമോ എന്നാ ചോദിച്ചത്.
അച്ഛൻ അറിയില്ലേ? കഴിഞ്ഞ മാസം പനാജി രണ്ടുപേരെ കുത്തിക്കൊന്ന ഈ മാറ്റിനങ്ങളാ.
കുഞ്ഞെ കഴുത്ത് നോക്കി ഒരൊറ്റ ഞെക്കിയെന്നുണ്ടല്ലോ. എന്നിട്ടാണോ അയാളുടെ ബൈക്കിന്റെ പുറകെ കയറി കറങ്ങുന്നത്? ഒരു പേടിയില്ലാതെ.
ഞാൻ തന്നെ പേടിക്കണ, എന്നെ വലിയ ഇഷ്ടാ.
അധോലോകം എന്ന് കേട്ടിട്ടുണ്ടോ നീ?
യെസ്, അണ്ടർവേൾഡ്.
ഏയ് അണ്ടർവേൾഡ്? ആ അണ്ടർവേൾഡിൽ ഒരു കുഞ്ഞു രാജാവാണ് പോയത്. കൊലപാതകം എന്നൊക്കെ പറഞ്ഞാണ്ടല്ലോ, അയക്കത് അതിങ്ങനെ അത്രേ ഉള്ളൂ. അതൊക്കെ പോട്ടെ, നീ എന്തിനാ അയാളുടെ വണ്ടി കയറി വന്നത്? സ്കൂൾ ബസ് കിട്ടിയില്ലേ?
സ്കൂൾ ബസ്സൊക്കെ കിട്ടി.
Yes,
പിന്നെ
this also
വീട്ടിൽ കയറി ഇരുന്നാ
these
മതിയായിരുന്നില്ലേ?
clippings also help for you to work out. Then a portrait there seems to be a friend. Then with an enjoy everyone's. Then with an everyone's what their friendship is more than just and superficial. They have the knack of the turning disaster into a cheerful or a comical situation, then associated easily with the strangers. There's another group of presentation of temperament. Then just to look at another one right in video at workplace.
എങ്ങനെയാണോ ക്ലാരറ്റ് വായിക്കുന്നേ?
സോറി സർ.
എന്താണോ ഇതൊക്കെ കമ്മീഷണറുടെ കുത്തകാന്ന് കരുതിയോ? എല്ലാം എടുത്തങ്ങോട്ട് നിരത്താൻ പറയണോ?
സർ കം ഓൺ.
എടോ, കാക്കിക്കുള്ളിലെ സംഗീതത്തെ കുറിച്ച് മഹാകവി വള്ളത്തോൾ പാടിയിട്ടുണ്ട്. കാക്കിക്കുള്ളിൽ തുടിക്കും ഹൃദയത്തിന്റെ അകമാനത് കല്ലൽ ഇരുമ്പല്ല, രാത്രി മാറ്റിക്കൊടുക്കുക തമ്പുരു വാർത്തിടും ഗാനകന്യക ഒന്നിനെ.
Yes, and workplace, then this kind of people we are watching, there are very creative and imaginative, then colorful peoples, then innovative ideas, have a variety of interests at workplace that people we are described under sanguine temperament. Then just you are collecting the rubric related to this one, the rubric indicate of sanguine temperament. Then always there are ailments from excitement, emotional, loquacity, vivacious, cheerful, company desire for, theorizing, forgetful, careless, thought, flow of rush. Why I consider all these features? This basis just I am trying to rubberize what are the medicine under this category. For that, we are collecting the few rubric related to our sanguine temperament. That is loquacity, vivacious, cheerful, then company desire for, theorizing, forgetful, careless, and thought flow of rush. There is an important drugs under this group. The lacasis, phosphorus, podophyllum, then likes the number of medicines is there. Then the sanguine temperament remedies like ferrum, phosphorus, lacasis, and ophia. Then one more video is helpful to work out this a particular sanguine temperament is an social butterfly. As a friend, extremely very funny and and everybody's attention towards the another character. Then enjoy being with people and easily become friends. Okay, just I will to okay in a sanguine temperament and recently treated a case, how to approach that case. Then for the understanding, just I would like to highlight in this case, the name is an Rohit and age and 15 years a male. The is a patient from the Thuthukudi. There's a presenting complaints and unable to walk steadily. Since in childhood onwards, he is not able to walk. The delayed milestone, crouch gait, always there, his gait is crouch gait. Then spasticity of the muscles in lower limbs with weakness, learning very difficult. That just you are collecting the symptom from that patient. Then history of presenting complaints, the 15 years old male with a delayed milestone after an episode of fever at age 1. He started to walk at the age of 6 only. But due to the spasticity of muscles, he was experiencing difficulty in walking. The patient presented to physiotherapy to help reverse his decline in walking. The patient has several conditions associated with his condition, such as epilepsy. These are the complaint associated as an epilepsy. The patient is now attending the special school for learning. He is doing his day-to-day activities with his mother's support. Then here, the recently started in our college, the Neuro Rehabilitation Center. The number of people are reached for the neuro rehabilitation is a wonderful result is there. Therefore, that type of one case is reached in our hospital for the neuro rehabilitation. And that particular patient, the history is like this. Then fast illness, history of fever at 1 year of age. Then there is no any family history. The family history only the mother, then allergic, from allergy. Then lifestyle investigation. The patient hails from the socio-economic family from childhood. He was facing difficulty in walking and learning. His parents joined him to a normal school from the 1st to 5th standard. After that, they are recognized he is not able to cope up with his own studies and other children's. Then they are changed into a special school. Then now he is studying in special school. As a person, patient is very lovely, mingle with every person he sees, even strangers. The patient got admitted in our inpatient unit. After admission, the very next day, he has started to talk with everyone in the ward and made good company. That because he is admitted in a particular ward, in general ward, is within a short period. His age is very limited age. Then he is mingled with other people within a short period. Then he is interested in doing therapies and very cooperative without any difficulties, and always interact with our interns and PG doctors. And he's always very friendly here talking. There is a personality history in the place. Personal history we are collecting. There is no any, there is an educational status, 10th standard, nutritional status, average. In general symptom, then I think relevant, almost is a normal, stool regular, urine normal. Then he's a desire for cold drinks and food. Then aversion, nothing particular. There is there is no any aversion. Then sweat increase in palms, soles with coldness, sleep good, reaction, chilly patient. In mental side, he is very vivacious, then active, extrovert, lively, the mingle with every person he sees, even as strangers. Even another people, then suppose in that particular ward, then other bystanders are there without any hesitation, he is mingled. Okay, the talk with everyone, always we are talk with everyone. Then these are the general appearing normal build, then fair complexion. Then here is an diagnosis of the cases and spastic diplegic, that is an cerebral palsy. There are two types, is an diplegic cerebral palsy, spastic cerebral palsy. The gait is a crouch gait. Then muscle tone, the power is just mentioned here in upper and lower limb. Then presentation wise, look this people, boy. Yes, and fair complexion. Always very careful mode. And good smile. Then interactive. It's an always and only positive attitude. Yes, and look at this. Then while presenting his look at this, it's friendly with everyone. Okay, then physically very thin, fair complexion, the fine hair, the lengthy eyelashes. These are the other features of the sanguine temperament. As a constitutional analysis, in this particular case, constitutional analysis, mental side, the temperament, there are mental and physical part. Then Lively mingles with every person and he sees every strangers, talk with everyone, physical thin, fair complexion, fine hair, lengthy eyelashes. There is a constitutional core. First one is the temperament. Second one is in mental side is the personality. In personality, we are out vivacious, active, extroverted. Then disease and aversion, disease, cold drinks and food. In diathesis, that is the brain affection. Then physical part, that is a disease and aversion, and we should work out the diathesis, the brain affection. All these we are considered and repertorized. Then in PDF, the brain, the softening of brain, and cerebral parts, we are considered these rubric. They we are considered the fourth medicine is there. Alumina, brighter, carb, kali, bromate, and phosphorus. In this case, we are selected phosphorus. The time is over. It's only 5 minutes remaining. Then thank you for everyone. Again, I would like to convey my gratitude to the organizers of IFPH. Thank you, Onanda. The remaining part of this and temperament, the choleric and remaining, we are discussed the remaining classes. Thank you, Onanda.
Thank you, Dr. Ajayan. And I'm very glad that the concept of Constitution in clinical practice, the initial session is excellent. And we will be continuing the next session. So I was not able to interrupt in the initial time, and I'm asking to ask you to just allow the participants to interact with you. So we will get another chance. The next class, we can interact with the speaker, and if some persons is there, can speak in 1 or 2 minutes, it will be appreciable. Dr. Hariharan is here. You can unmute.
Sir, my doubt is that you said personality and temperament. See, in addition to that, the fear, the food preference, and see the ailments due to, and see the general features. These are all should be considered. Otherwise, we will not get a collective constitution.
Sir, definitely, sir. Then in my topic, I will then included that one. Then here are 2 legs are there, the mental and the physical part. In physical part, definitely disease and aversion and diathesis is there. Then the personality part, we are discussing all these things, sir. Therefore, the personality that today I am not highlighting. Then only the temperament part. In mental part, there are 2 sides. One is the temperament and personality. In personality classes, we are discussing all these things, sir. Okay?
That's
definitely not. Okay,
yes,
sir?
Please continue. Please continue.
Yes, because then the study of the Constitution is not a simple one. There's so many factors we are considered for the study of the Constitution. That within the stipulated time, we are not finishing the entire part. Therefore, then first section, I'm trying to highlighting there is an Constitution means the temperament, personality, there is and physical part is a diathesis is there. That today there I am trying to convey with the temperament part. In temperament, and then only we are discussing the sanguine temperament. Okay, sir?
Thank you.
Hello,
And next is Mr. Farid Bauhan.
Yeah, I am of the opinion that the energy part also should be included in that. You have mentioned about the mental and the physical part. Energy is also a particular, is a very important component of this temperament component. That is what I understand. Thank you. It's an excellent class.
Okay. Thank you, sir. Thank you for your contribution.
So it's a time to conclude the session. Let me welcome Dr. Manoj for the vote of thanks.
Very nice presentation, Dr. Ajayan. There is no doubt about his potential, and we must utilize him. He has got a lot of tremendous potential that we cannot measure. That is Dr. Ajayan. On behalf of IFPH, I am expressing sincere thanks to Dr. Ajayan and all those who have participated in the program. And everybody should continue to participate regularly so that we will be more enriched. Thank you, Dr. Ajayan.
Thank you, sir. Thank you, sir.